In this module, we'll discuss in detail the various planning elements and their relationship to one another. Vision is the perceived future state. Where do you want to be as an organization or group in the future? Vision statements generally represent the ideal future state, which will often be a stretch to achieve. Some examples of vision statements are a healthy and safe community, to be the healthiest state in the nation, an EMS and trauma system through which all citizens would suffer less illness and injury. Those that do suffer illness or injury would have the best chance of survival and recovery. Communities that are unified and purposeful, giving themselves the best chance of successful health outcomes. A state of optimal community health for the residents and visitors of the county. The mission statement represents the current state. What are we doing to move towards our vision? As you're developing an operational plan, you should ask the question, does this planning element contribute to the mission? If not, you may want to ask, do you need this portion of the plan, or should the mission be updated to include this? Typically, vision, mission, and values are fairly consistent across the organization. Mission statements may, however, vary by division, office, or program. For example, the WIC program may have a different mission statement than the Public Health Emergency Preparedness Program. They're both helping the entire organization reach the common vision, but in different ways. Here are some examples of mission statements. To protect and promote the health and well-being of county residents and visitors by educating, enabling, and empowering them. To protect, promote, and improve the health of all people in the state through integrated state, county, and community efforts. To protect the health and safety of people requiring emergency medical services, promote improvements in the EMS and trauma system through research, education of the public, EMS and trauma providers, and provide courteous, professional, and responsible service to the public and providers. Values are our basic operating principles. What things are important to us as an organization? As you develop planning elements, you should ask the question, does this element of the plan reflect the values of our group? If not, why? How can it be updated to reflect the values of the organization? Here are some examples of values. Accountability, to be professionally responsible for all actions we take. Honesty, integrity, conducting all business truthfully and in the best interests of our clients. Client-centered, always striving to meet the needs of those we serve. Ownership, taking responsibility for both individual and team actions. Respect, working together with mutual respect and cooperation. Access, providing quality, comprehensive services that are navigable, accessible, and affordable to all community members. Now let's do a little exercise. Please identify each of these statements as a vision, mission, or value statement and why. We are fair, honest, ethical, and accountable to our customers and coworkers. Ask yourself, does this represent a future state? Does it show how we intend to get to the future state? Or is it one of our basic principles? This statement is a value, probably something like integrity, because it defines one of our basic operating principles. To promote, protect, and improve the public health in the county. This could be a mission statement because it talks about doing something to reach the vision. We work together to establish common goals and achieve the desired results. This is another value, in this case, teamwork. To become recognized by the public as the local advocate in promoting, addressing, and safeguarding public health and the environment. This is probably a vision statement because it describes a future state. To promote and protect the health and well-being of the community. Again, this is a mission because it describes what we're doing to get to the desired future state. Excellence in leadership through innovation and collaboration. This is probably a vision statement, although it also might be referring to the value of leadership. Planning elements get increasingly more detailed as you go down the pyramid. Services are typically just a short description of what we do or want to do. Goals describe, at the highest level, how we perform the service or will perform the initiatives. In addition to the goal statement, goals have a red, yellow, green, or gold status flag. Objectives describe how we intend to achieve the goals. Objectives also have a status flag. In addition, there is generally an objective leader assigned. Activities are the most detailed planning element. Activities also have a status flag, as well as a performance metric, activity type, percent done, start and end dates, team leader, team members, and any partners assigned. Activities roll up to objectives, objectives roll up to goals, and goals roll up to services and initiatives. Services are those functions that you currently provide to constituents, partners, or the organization. Initiatives are future services that you'd like to provide. Services and initiatives typically belong to a specific division, office, or program. They're considered to be within the context and mission of that group. Services and initiatives are often differentiated only by the time frame of the goals, objectives, and activities under them. Initiatives will have future dates associated with them, where services generally have current dates. Here are some examples of services or initiative statements. Create a healthier county through policy, system, and environmental approaches. Increase efficiency and effectiveness. Maximize resources. Financial management of grants. Community outreach and education. Health screening. Ryan White Dental Insurance. Nutrition services and training. Goals, objectives, and activities define the how we do it planning elements for services and initiatives. Each has somewhat more detail than the previous or higher level planning element. Goals, objectives, and activities are generally tracked with some type of status indicator. This is often a green, yellow, or red flag. Each service may have one or more goals, each goal may have one or more objectives, and each objective may have one or more activities. Here are some examples of goals. Invest in continual improvement initiatives. Stimulate cross-program collaboration. Meet community needs through innovative funding mechanisms. Integrate public health and healthcare systems. Objectives define how goals are accomplished. Each goal may have one or more objectives. Objectives are typically more specific than goals. Objectives are generally SMART, meaning specific, measurable, attainable, realistic, and time-bound. Some examples of SMART objectives are: by December 2017, Health Department partners will understand their role in the public health system as measured by 80% of the participants' responses in the local public health performance standards assessment. By February 2016, complete at least 2 new projects with the county departments that impact health to explore collaborative partnerships. By June 2017, the Health Department will increase the number of partners that access technical assistance services designed to support PSE work in the community by 10% over the 2014 baseline. By November 2015, ensure each division has started developing a continuity of operations plan. Activities define how the objectives will be accomplished. Each objective can have one or more activities. Activities are more specific than objectives and have several parameters in addition to the activity statement. Activities have a performance metric. How will you know when the activity has been successfully completed? Activities can be project-based, qualitative, or quantitative in nature. We'll discuss this in a few minutes. They have start dates and end dates, status and percent complete. Activities are generally linked to team members, a team leader, and external partners. They generally have ongoing progress notes attached. Each objective can have several activities. Activities are the most detailed level of definition of the how we do it elements. There are 3 types of activities. Project-based activities are to be progressively completed over a specific period of time. They're measured by start date, end date, and percent complete. An example of a project-based activity might be to provide vaccinations to all school children between January 1st, 2015 and December 31st, 2015. The start date is January 1st, the end date is December 31st. If the current date is June 30th and half of the school children have been vaccinated, the percent complete would be 50%, right on track. The next type of activity is a quality assurance activity, or QA activity. QA activities are activities performed on an ongoing basis and measured regularly. The activities have a frequency which might be any one of these values. QA activities also have a high and a low value, and finally a metric type. An example of a QA activity might be to install 20 car seats each week. In this case, the frequency is weekly. The high value might be set to 20 and the low value set to 15, indicating that if 20 or more car seats were installed, the status flag would automatically be set to green. If less than 15 seats are installed, the status flag would be set to red. And if 15 to 19 were installed, the status flag would be set to yellow. QA activities are unique in the fact that the traffic light is automatically set based on the established high and low values. The metric type in this case would be car seats installed. The last type of activity is the quantitative measurement, or QM activity. These activities are very similar to project-based activities with the addition of a target number field. They have a start date and an end date, a target number, and a metric type. An example of a quantitative measurement activity would be to deliver 50 nutrition consultations between July 1st, 2015 and June 30th, 2016. In this case, the target number would be 50 and the metric type would be nutrition consultations. With a target number defined, the percent complete for QM activities can be automatically calculated. Some examples of activities are: conduct quality improvement training for all staff. This would be a project-based activity. Create a cloud work group to conduct a QI project. Again, a project-based activity. 4 QIC meetings between 5/7/2015 and 7/30/2015. This would be a quantitative measurement activity because the target number is defined. Work plan updates published to mhm.org measured quarterly. Green is greater than or equal to 3, yellow is between 1 and 3, and red is less than or equal to 1. This is a QA activity. Map county funding streams in order to determine potential opportunities to maximize impact. Again, this is a project-based activity. This concludes this module in the training series for the dashboard. If you have any questions or would like more information on the VMSG Dashboard Performance Management System, please contact us with the contact information here.